Today we're here to discuss the potential risk-benefit alternatives and unforeseen complications associated with Varithena. Varithena is a proprietary mixture of polydocanol, which is a sclerosing agent that we inject it into the veins by way of a catheter. The potential side effects associated with Varithena include the following. Transient hyperpigmentation occurs in about 10% of the patients. Ulcerations occur less than 1%. Allergic reactions are very rare. Pain, a few patients may experience moderate pain at the site of injection. Telangiectatic matting, which are fine blood vessels that occur in the area of the treated vein. This occurs in 2 to 4% of all patients. Ankle and leg swelling may occur after treatment. Deep vein phlebitis is a rare complication, seen in about 1 in 10,000 patients treated. Arterial injections are very rare, occurring in 1 in 100,000 patients treated. A summary of the consent will be provided to you by a nursing staff for you to sign. In anticipation of your radiofrequency ablation, I hope to outline how the procedure is performed. Briefly, we numb the surrounding tissue prior to introducing our catheter. We use local lidocaine. The catheter is advanced to the groin area. Once the catheter is in position, we inject on 4 or 5 locations a numbing medicine to minimize any pain or tenderness prior to the procedure. The potential risk-benefit alternative and unforeseen complications will be outlined and include the following. Allergic reactions, which are very rare. Pain you may experience at the site of injection, although local anesthesia enables us to minimize this. Infection, very rare. Bleeding, very rare. Swelling, burn, nerve trauma. Occasional phlebitis, which is a temporary disruption of the normal vein due to inflammation. Telangiectatic matting, including new spider veins that occur in 2 to 4% of the patients, which tends to resolve within 2 to 4 weeks post-procedure. At the conclusion of the radiofrequency procedure, the leg is wrapped with a compression bandage and a compression hose that is left on for 24 hours. We encourage you to ambulate as often as you can throughout the following day. No limitations in your workload are necessary post-procedure. In anticipation of your ambulatory phlebectomy, which is a procedure used in the office, it's a brief surgical procedure enabling us to remove varicose veins utilizing a small hook. Each of the area is locally anesthetized with lidocaine. A small incision is made over the vein, and the vein is removed surgically. This takes an average of 45 minutes to an hour, depending on the extent and the length of the vein. The potential risk and side effects include the following: an allergic reaction, pain, which is some discomfort during the numbing of the procedure, swelling, you may experience swelling briefly following the procedure, telangiectatic matting, which are new spider veins, hyperpigmentation, nerve trauma, which is occasional but quite rare. This may lead to transient numbness that resolves on its own, recurrence of new veins, a potential risk of deep vein thrombosis, although a very rare complication involving the deeper veins. If you anticipate an ambulatory phlebectomy procedure, there will be an official consent for your signature. Varicose veins and spider veins are a common problem presenting as early venous disorder. If you anticipate sclerotherapy of your veins, which requires a very fine needle and the introduction of a sclerosing agent known as polydocanol. This is an agent that is infused into the superficial veins, enabling them to go into spasm, shrink, and scar down. There are potential risk benefits associated with this procedure. The risk and benefits include the following. Transient hyperpigmentation occurs in about 10% of the patients undergoing sclerotherapy. Ulcerations occur in less than 1% of those who receive sclerotherapy. Allergic reactions are very rare. Pain, very mild at the site of injection. Telangiectatic matting occurring 2 to 4 weeks after the procedure, which tends to resolve within 4 to 6 months. Ankle and leg swelling may occur, which is quite rare. Deep vein phlebitis is a rare complication. Arterial injection, again, is a very rare complication. If you anticipate sclerotherapy as part of your treatment plan, a full consent will be provided to you by a nurse for your signature.